Hello, and welcome to the Part 3 Regeno Therapy Drainage and Detox webinar series. We will be talking about transforming patient care for improving your clinical outcomes and, of course, improving how your patients are feeling. My name is Heather Schofield, and we are joined also with Lesia Galoida. And we are really excited to be able to share our experience with all of you on the webinar tonight. Okay, so to introduce myself, for those of you that don't know me, my name is Heather Schofield. I'm the Education Director here at Biomed, and I act also as a medical advisor. With the drainage and detoxification, I'm really fortunate and feel very privileged to have studied under some incredible mentors, both from Europe and then throughout Canada and the US. And this is where I really learned the principles of drainage and detoxification, and then have used the last 2 decades to practice with these remedies and formulas. And I know that this is also echoed with Lesia as well. So the information that we're sharing tonight is information, of course, that we learned from our mentors, but then we've also had the ability to use in practical application, both in our own private practices and in addition to hear feedback from practitioners right across Canada and the US. And so it's always an honor to be able to take this information and be able to share it out to the next generation of practitioners so that you can start using these remedies or using more of them in your day-to-day practice. And so I'm going to pass it to Lesia so she can introduce herself.
Yes, thank you, Heather. Um, I'm Lesia Galoida. I'm your professional advisor in Ontario. I'm happy to support every practitioner with my educational and clinical support and share the experience that I have gained working for Biomed for many years in the past, and also being in the role of medical advisor. And this is once again a great opportunity, which I grateful for Heather to join her for the webinar and just to demonstrate you that I will be more than happy to support you in a day-to-day practice with the knowledge of the remedies, with the knowledge of the protocols. So I'm kind of taking a little part, but it's actually opportunity for me to introduce myself and my services to all of my Ontario customers. So I hope you will take advantage of that. Okay, then we'll start the webinar tonight. And thank you, Heather.
Great. Thank you, Lesia. And please do take her up on the offer because Lesia is incredibly knowledgeable and will be able to really help um, advance your own learning with the regenotherapy formulas, especially in clinical practice and in your protocols. Okay, so what we are going to cover in this webinar is we're going to do a quick review of drainage and detox principles. We're going to talk about primary and secondary emunctories with the focus on the secondary portion of the emunctories that are essential in the body for detoxification. And then we're going to flip into formulas and clinical applications for a whole variety of conditions, including the sinuses and the respiratory system, thyroid, prostate, pancreas, joint circulation, venous circulation, and adrenal and hormonal regulation. And so let's get started with all of those. Okay, so let's do a quick review. For those of you who've been on the webinar series and those that are just joining today, let's talk a little bit about drainage and detoxification and what the principles are. So the Regeno Therapy formulas, they are 60 plus years old and they've been used in Canada for over 2 decades. These formulas, they're recognized as being very effective and a very outstanding quality. The formulas were originally put together with naturopaths and with pharmacists and working in a clinical setting to really find out what was working for the patients. For a drainage and detox formula, there is a set of criteria that needs to be met in order for it to be classified as a drainage and detox formula. So number one, or the first part, is that it must increase circulation to a specific area or to a specific organ or to a set of organs in a system of organs. Next, it must have a biochemically active effect in the body. And so it must prompt something. When we were talking about drainage and detox for the stomach, the absinthium formula, its biochemical action is it increases hydrochloric acid production in the parietal cells of the stomach. And so all of these formulas have to have some sort of biologically active, or sorry, biochemical active effect. And then finally, it needs to improve metabolic function of that organ or organ systems. So throughout the presentation, we will be putting a nod back to increasing circulation, improving function, or the type of biochemical effect that the different remedies have as we go through them. And so the other really important thing to know about the Regeno Therapy remedies is that they have very clear clinical indications. So what you're seeing and what's being presented throughout this webinar and this webinar series is what it's used for. The beauty is that if you already have patients that you're working on with these remedies, you can choose one and it can be added to an existing protocol that you're using. And this is often when we talk about improved clinical outcomes by adding some of these drainage and detox formulas to what you're already doing is going to allow everything to be more effective. The other benefit is they're very cost effective and you will achieve a targeted elimination or drainage and detox in the body. So most of these remedies, they stimulate organ function within 20 minutes of the remedy being taken. And then for best therapeutic results, it's typically recommended to be using for 2 to 3 months. And this is all based on cell turnover in the body and regeneration. Um, this is just a general guideline. It's not necessarily for every formula or for every case, but if you're really wondering how long should I be using this for, think kind of 2 to 3 months as a general guideline. Okay, so now let's do some review of the primary and secondary emunctories. And I know all of you are familiar with the primary emunctories, or emunctories are also known as a route of elimination for draining or removing waste material from the body. That's the original homotoxicology definition for a emunctory. But a emunctory essentially is a detox organ or a drainage organ. So the primary ones, which we spent already time talking about in the part one webinar, is the liver, the kidneys. The liver also includes the gallbladder because of the bile, the intestinal system, the mucous membranes, the lymphatics, and the skin. Technically, the lungs could also be in that space as well. The secondary emunctories, these are not the primary place that toxins are being moved from the body. And a lot of the time, these organs may also be draining through the primary emunctories. And so there's a few different things to be understanding about the primary versus secondary emunctories. So the primary emunctories are the primary organs for detox, or as I like to talk about, the main pipes where things are draining out of the body. So you've got the liver and the bile, and then that flows into the intestinal system, which then gets evacuated via stool. You also have the blood that gets filtered through the kidneys and gets evacuated via urine. The breath, when we're breathing, then you end up getting toxic load evacuated through the outbreath from the lungs. And so you have these primary organs, and then the secondary organs are kind of the secondary emunctories. They are the ones that funnel into the main pipes. So we need to make sure that the main pipes are open and working well. And this is why we started the whole webinar series as part one, talking about the liver, the kidneys, the gallbladder, and the lymphatics. And so once you have those pipes moving and making sure that they're open and detoxing well, then you can start to work on the secondary emunctories and the tertiary emunctories or drainage. And so you've got them funneling into the main pipes for the secondary organs. And then these tertiary drainage, it's often of the extracellular and the intracellular spaces. And so those spaces once you get the main pipes flowing and the secondary organs funneling in, now there's space for the extracellular and intracellular spaces of the cells to be able to start moving toxic load out of there. And so that is draining into the funnel. So once you've got your main pipes flowing, then everything else can start to funnel in. A lot of what we're going to be talking about is the secondary and kind of third drainage component. And it includes the nose and the sinuses through the mucus. We're going to talk about the lungs. We did talk about the stomach last week in part two. We're also going to talk about the pancreas. We don't always talk about the pancreas from a drainage and detox perspective. We're going to be talking about the thyroid also from that perspective, the bladder, which we talked about and covered in part one, and then finally the reproductive organs. Yet again, not necessarily things that we're talking about from a drainage perspective in our daily language with our patients, but this is a way to start to understand when we're thinking from that homotoxicology or toxic load in the body system, how do we start moving it out so that the body has better opportunity to self-regulate and not to be so burdened down with toxins from the environment, etc. So once we've covered those, oh, let's see here. Now we're going to actually just jump straight into the different formulas. And so there's quite a few we're going to cover. If you do have questions, please pop them into the Q&A section as we go along. And then, whoops, sorry, and then we'll be able to answer them towards the end of the presentation. Okay, so first and foremost, we will talk about the sinuses, the immune system, and allergies. And so we've got four Regeno formulas that fall into this category. And that includes Allernest, it includes Bronca, it includes BioBoost, and Hydrastis nasal spray. All four of these formulas, they're very classic formulas that are used to increase circulation, decrease inflammation, and promote drainage and mucus flow of the respiratory tract in varying degrees. So really, there's a sinus component, a lung and bronchial component, and then just upper respiratory and respiratory in general. And so the first one we will talk about is Hydrastis nasal spray. One of the things that is really interesting to know is Hydrastis nasal spray is a top seller. It probably in the whole Regeno Therapy line, it is the number one formula. So this is something that if you do not have a sinus spray in your practice, then this is one that you definitely want to be paying attention to because it's very effective. It acts very quickly and it provides a lot of relief, especially for those chronic sinusitis patients. So, Hydrastis nasal spray, it's a fast-acting sinus relief in cases of sinusitis, chronic nasal inflammation, and allergies. It is typically used in sinus infections and a sinusitis, whether it's an acute sinusitis or if it's a chronic long-standing sinusitis. Also for those that have like a blocked nose. So chronic rhinitis means kind of a runny, blocked nose where there's runny, stuffy, pain, pressure. Those that have nasal passages that dry out easily and then they get nosebleeds. There's definitely certain areas of the country that are drier than other areas. And the Hydrastis nasal spray does have a very moisturizing effect. Or if people, when they're flying and then they end up getting dry nasal passages and nosebleeds, then this can help protect against that. Um, Microbial infections. So Hydrastis nasal spray also, it works on bacterial, viral, and fungal microorganisms, and then it's also a biofilm breaker. And in the sinuses, there's lots of mucus and there's loads of biofilm. It's a nice dark cave for things to be living and proliferating and colonizing. And so being able to have something to get directly into that area, so into the sinuses, is very beneficial. And then finally, seasonal allergies. So this season is upon us shortly. And so those that are suffer from hay fever, difficulty breathing, kind of stuffed up nasal passages, sneezing, runny nose, or sinus inflammation, then symptomatic relief is very helpful there as well. The mode of action is it does quite a few different things. So it overall is regenerating the function of the mucous membranes in the sinus and nasal passages. When you use it, it helps to stimulate mucus flow and it helps to get the mucus draining and flowing. So this is the drainage part of this. And so whatever's sitting in the mucus, so let's say pollen, for example, it's going to get the mucus flowing and it's going to be helping to clear the sinus passages. So that's one of the ways that it works. And then it also decreases inflammation. So if somebody's having a sinusitis, chronic or acute, it helps to decrease the inflammation, which is helping to um, relieve the symptoms, including pain, and helps to open up the airways and breathing. It moisturizes his nasal passages, and then it helps to normalize breathing. It basically unblocks the sinuses, so it makes breathing easier. And um, the dosing on this one is 1 to 2 sprays up each nostril. And when you use it, what you want to do is just before you do the spray, get ready to also take a big inhale. So as you're spraying, you're inhaling it to try to get it deep into the sinuses. You can use it several times a day, up to 5 times daily or as needed. The one thing to really note about this is some people may experience a burning sensation when they're first using it. And if they do, have a burning sensation, it's an indication that there's actually a lot of inflammation, which means that is something that they really need to use in order to help get the relief in the sinuses and get that inflammation reduced. So the advice is to keep going as it is designed to reduce inflammation and heal the sinus passages. If it's a bit too intense in the first days, they can put some of the like spray some hydrosis nasal spray into a neti pot and then neti it through as they're kind of working on the inflammation. The other thing to really note here is this formula is not designed for children. Just because of the potential burning sensation, and that can be very unpleasant. We have some other great things that kids can use instead. Okay, I did see some questions come through. I'm gonna see if I can pull these up. Um, So, because we're topical, so da 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 da. So, Julie, loofah tabs would work in a plan for the remedies for the sinuses. So, this is a good question. We have hydrosis nasal spray, which is working at reducing inflammation and getting the mucus flowing and helping with symptoms that are related to sinusitis and allergies. The Pleo loofah, so the Sanum formula, the loofah tabs, it's a tablet that goes under the tongue. It's a single ingredient, and it's also working at reducing symptoms that are associated with the sinuses. It actually is one that you could use with kids if there's sinus connections there. And so I'd say that generally you'd find that the hydrosis nasal spray, because it's a drainage component, it really does get the mucus flowing. In addition to everything else, the loofah tabs tends to work on um, not so much a mucus flowing component, but more about reducing inflammation and helping with symptoms associated with that. So I hope that answers your question. All right. And Larissa, I probably for a child, what age? I probably would wait until they're a little bit older, meaning 12 and up, maybe even a bit older than that. I guess it would depend on the constitution of a 12-year-old and how well they can manage things. If they can use a neti pot, then potentially kind of from that age up. It's more just, again, about this burning sensation, and you don't want to be creating discomfort in a child that then may refuse to continue using the formula. You could start though with the loofah tabs, the Sanum formula, if there's sinus stuff, just to kind of calm things down, and that would be kind of the first place with kids. Okay. Now, I want to flip over to talking about allergies and Allernest. So Allernest, it is a formula that works like a natural antihistamine. It has a very fast acting relief from seasonal, acute, and chronic allergy symptoms. So these can be seasonal allergies, environmental allergies, and food allergies. It generally works within about 20 minutes of taking it, and the effects can last up to 8 hours. So Allernest is a really nice formula to have on board during allergy season for those patients and clients that basically are affected or have spring allergies. And then they can take it in the morning, they can take it 8 hours later, and then they can take it before bed. So they kind of have a rotation of helping to keep the inflammation down and the allergy symptoms under control. Seasonal allergy symptoms that it works for: hay fever, difficulty breathing, sneezing, coughing, runny nose, rashes, itchy skin, itchy eyes, and kind of the whole gambit that goes there. In the more food component, it's still, because it works as a natural antihistamine, if the food reaction is like an allergic inflammatory due to histamine, then it's going to help to calm that down as well. Again, the mode of action, it's a natural antihistamine. It helps to stabilize histamine levels. It helps to decrease that hypersensitive reactive component, which is associated, of course, with allergies. And then in addition, it does reduce inflammation and swelling of the mucous membranes of the upper respiratory tract, and then finally helping to strengthen the cell walls. So your general dosing, it's 10 drops in water 3 times a day. This would be for those allergy patients that want to make it through allergy season, then they can just start doing that dosing. If it's acute and they really need to calm things down quickly, they can take 10 drops in water every 15 minutes until symptoms improve. This formula is ideal for all ages and also really safe with kids as well. It's a homeopathic, and that's one of the reasons that it's safe with kids. And that dosing, the 10 drops, that would be an adult dosing. So if you've got kids that are under 6, then you could do it at half the dose, so 5 drops in water X amount of times a day. Okay, so now I'm going to just share this allergy and sinusitis protocol. And it's a little bit of repeat of what we just said. So in that allergy and sinusitis space, Allernest, we've talked about our dosing. During allergy season, it can be 10 drops in water 3 times a day. The sinusitis component, so Hydrastis nasal spray, it can be used again for sinus symptoms, sinusitis symptom, blocked nasal passages, or if there's the allergies that are associated with the sinuses, to help reduce that congestion, reduce the inflammation, get the mucus flowing so that the pollen is getting flushed out, and it helps to improve the breathing as well. And so 1 to 2 sprays up each nostril, and then doing that up to 5 times a day or as needed. And then finally, the other part um, is to put some vitamin C or some quercetin on board. And there's a point I want to make about this. So when we're talking about drainage and detoxification, we're not necessarily talking about it as a standalone therapy. Lots of the drainage and detox remedies can be standalone. Allernest and Hydrastis nasal spray both are great standalone formulas. But when we're working deeper to try to hit root cause and doing that, moving toxic load out of the system, a lot of the time we're adding these formulas into other types of protocols or adding other support in. And so we just wanted to really make it clear that for these remedies, we're not always just saying, take this and this is going to solve all the problems. Instead, we do offer, especially in this presentation, some additional things that are going to help the success of the protocol. And so that brings us back to vitamin C or quercetin. The biggest thing is that um, the more vitamin C or the more quercetin you have in your system, the less histamine you'll have. And so vitamin C or quercetin, it works to reduce the histamine load in the mast cells. And that makes somebody less reactive overall because there's less histamine in the cells. And then it also helps to reduce inflammation. So if there is somebody suffering from allergies, having vitamin C or quercetin in a daily protocol can be really helpful to make them less reactive overall. With vitamin C, it's minimum 3,000 milligrams a day. With quercetin, it can be one capsule twice a day. And both of these formulas, interestingly enough, are liposomal and or phytosomals, so they have a really high absorption. And then, of course, the last things to think about is air purifiers, stay well hydrated to keep that mucus flowing, and avoid inflammatory and histamine-rich foods. Okay, so I just, again, saw another question come through. I'm just going to see if I can answer this. So Julie asked the question, are you saying that Allernest can be used for food reactions that occur outside the sinus respiratory tract, like a digestive reaction? The answer is yes. Allernest, so let me just go back to the Allernest slide quickly. So Allernest, we're talking about it in kind of that seasonal acute allergy, but it's basically working for all types of allergies. So yes, the seasonal or environmental. So that's not necessarily associated with seasonal. So let's say cat hair or dog hair, for example. And then also with food, because it's working like a natural antihistamine, it's working broadly throughout the entire body. So if somebody is having um, allergic reaction due to food, then it is also going to be helping to take down that reaction in the body. Okay. So we're going to now talk about cold, flu, and the immune support. BioBoost is a long-standing formula that is very well known to be used for cold and flu season. I love the Christmas stocking stories that I hear from practitioners every year, where they order 6 or 12 of them. And I, in the early days, would be so curious and asking, why are you ordering so much in December? And then they would share that they are adding it to friends, family, their stockings at Christmas or for patients. Because it is something you want to keep in the medicine cabinet or the first aid kit at home, not only just for ourselves, but also when our patients have this at home, you know they can take care of all those acute cold and flu symptoms that show up during kind of that cold and flu season or the winter season. So BioBoost, it boosts the immune system. And then you can use it preventatively, you can use it acutely, you can use it as a cold is coming on to try to speed through to reduce the severity and duration of symptoms, or you can use it in the middle of a cold to help, again, reduce that severity and duration of symptoms, and so to get better faster. It's best known for colds and flus, and because it's very viral, works very viral in nature. So, of all the kind of things, like I often think of it working for any viral type symptoms or viral infection. It also can be used for lymphatic inflammation, respiratory tract infections, fevers, the exhaustion and weakness that can come from acute symptoms, and then those types of infections, viral, bacterial, and fungal. Basically, what it's doing is it's helping to increase your immune function, your baseline immune function, and it's stimulating the innate immune response. And it's doing that through boosting leukocytes and granulocytes. And what that's doing then is it's getting the body to start reducing inflammation, fight the infection, clear out the infection, and clear out the cellular debris from the infection. And then, in addition, with the phagocyte function of the leukocytes or the white blood cells, it's kind of engulfing and destroying the pathogens, particularly bacteria and viruses. So you have this kind of complete take care of the actual pathogens and then clear out the inflammation and the infection and the cellular debris that's coming from that as well. And so that is why it's helping to kind of speed through the acute symptoms and get you better faster. I've heard of also lots of experiments over the years where some people took it and other people didn't in the same household. And the ones who were taking it definitely were getting better days before their counterparts. Um, So then your general dosing, it's 20 drops in water 3 times a day. If there's an acute situation, so if that's the feeling of a cold or a flu coming on, then 40 drops in water every 4 hours until signs of improvement. Again, this is another formula that is safe for children and it's ideal for all ages. And I would definitely recommend, I know we're coming towards the end of this cold season, temperature cold. There's still, though, some very nasty colds and flus going around. There's lots of GI stuff happening. There's also lots of sinus colds and people getting really sick. So it can still be very relevant to help our patients out in those cases. Okay, so now we're going to move over to Bronca, and Lesia is going to share on this.
Thank you, Heather. Yes, another amazing product from Regeno Therapy, Bronca. It's for chest, lungs, and upper respiratory support. It's very well researched, extensively researched herbs in a product to demonstrate effectiveness for the decades. Because we have a lot of cough syrups, and some people already have favorites, and obviously they don't come to a practitioner to get another cough syrup or something for cough. So what's unique and different about Bronca? So yes, you can use Bronca to reduce and relieve coughs. You can use in acute and chronic bronchitis. You can use for the when the cough descend more in the chest, affecting the lungs. You can use Bronca with the excess mucus, again affecting entire upper respiratory system. And also, it's great even in the conditions when there is a more like a wheezing component. That's we are talking about asthma, and or cough comes as a result of the infections. So Bronca, it's quite effective, and it's alternative when you don't want a syrup, when you don't want something sweet, even if it's not the sugar. So you can use a teaspoon in a water, or you can use drops. Heather mentioned Allernest. So when you have the more allergic cough, you can combine Allernest with Bronca. It's a kind of clinical tip, clinical pearl. And also because it relieves the cramps in the bronchial tree, so it will be great alternative to try before patients use a puffer, corticosteroids, or any other bronchodilator. Then in terms of the loosening mucus and expectoration, it's also a great remedy. It might promote perspiration, because when we are perspiring, we are kind of detoxifying. Usually happens with the fever during the cold or flu, and it does really help with the because it brings the circulations to the area and has affinity to bronchial tree and lungs and upper respiratory tract. Obviously, it's the improvement of the oxygen intake, improvement of the function. If you have also like to calm cough reflex, Heather had mentioned Avena sativa. So combining Avena sativa with the Bronca, you can actually stop, when it's a persistent cough, and the kind of comes in this cough fits. Also, I remember from the past, from our experience mentors, saying Bronca can be used acutely, but it can also used preventatively. What I kind of remember for 20 years, if you have an elderly patient and they are prone to have a pneumonia or chronic bronchitis with the flare-ups every year, every fall, so don't wait until they get sick, because obviously they don't have this vital force to fight infection as they come. So we rather prevent than spend a lot of effort treating it. So using Bronca once a day in the beginning of season for elderly patients or the young patients who are prone to pneumonia, bronchitis, and any even when the asthma gets kind of aggravated during those seasons. Will be an amazing preventative measure. Also, I want to mention old naturopath, Dr. Alexander Wood. When he was talking about the drainage and asthma, he mentioned a quite unique clinical pearl. And will be not in competition with the Regeno Therapy. I want to mention peppermint oil, peppermint essential oil. So when you have a patient with asthma and they are using the puffers, they're using the bronchodilator. Usually, it comes with a great relief, but also comes with some side effects. And many patients won't even at least reduce the amount of the use. So, peppermint oil is a great bronchodilator, and you can find this ingredient like menthol in many cough formulas. So when you use one drop of the essential oil, and you cannot put it in the mouth because sometimes it's too burning and it's not for kids. But if you can put on a clean skin, and this is how was demonstrated to us, so that's I'm trying to demonstrate to you. You can take your palm and you can put just one drop, so you visually you can see the dose, and you can just lick it. So when you lick the one drop of the peppermint oil, you already feel the lung expansion and the bronchial expansion. So if it works for you for asthma attack, great. If it doesn't, you always have your bronchodilator handy. But peppermint oil have much less negative effect than corticosteroids. So I hope this you can try, especially even you don't have to have asthma, but sometimes wheezing and tightness and this irritating cough could be quite annoying. And the peppermint oil can be used in addition of bronca. So in acute conditions, you can use 30 to 40 drops in water 3 to 5 times a day. Preventatively, you can take once a day. For kids, you obviously not the very young one, but you can reduce the dose in half or in third, depend on the age. So, and as Heather has mentioned, Regeno therapy doesn't have to be, or drainage therapy doesn't have to be standalone. Yes, we can use this if we have just the flare up of single symptoms. So, broncha can be used for lungs for bronchial support to reduce inflammation, to take away the spasm, open airways, loosen mucus, help with the cough. But you can also support the healing process with the systemic enzymes. And if you have met with me in the last couple of months, I am not tired to talk about the serrapeptase. Serrapeptase is a systemic enzyme that has a amazing strong mucolytic properties. So when you have a lot of mucus build up, serrapeptase it's an amazing product to add on to break down that mucus and help body to expectorate. So it's great for the sinuses, but also great for the chest congestion. And as usual, liposomal vitamin C, we have C Boost in the powder form or Bio-C in the capsule form. It's a great potent antioxidant, will boost the immune system and reduce inflammation. Everybody know that about vitamin C. So we do also suggest some non-medicinal therapies like warm compresses on the chest, drinking a lot of liquids because you do need to dilute the mucus. And you can use peppermint oil to dilute the bronchi, to open up the bronchial tree, but you can also use eucalyptus when you are showering because it will affect entire, like all the passage, it's open all the passages. So we do have this protocols handy, and we'll be more than happy to send those by emails as needed.
Great. Thank you, Lesia.
Welcome.
Was a couple of questions that came through that I would really
Mhm.
like to answer. Just quickly, I did answer them kind of in the chat, but they're relevant, so I thought I would read them out loud. So Julie is asked about Bronca. Can it be used for kids? Yes, Lesia did talk about using Bronca for kids at a reduced dosage. And then Julie also asked, how does it taste? The nice thing about Bronca is it's got a very mild herbal taste, not strong like the bitters that we talked about last week. It's mostly got a thyme kind of pepperminty taste, and it's quite pleasant. So with kids, because you'd be putting it in water or juice and diluting it, it's something that kids could definitely manage to use.
Yeah. It comes with the alcohol, but because of the small amount that we are using dosage, then it's suitable for kids. It will be kind of no more than in apple juice or any other sources. Yeah.
Exactly. And then there's two quick questions about BioBoost. And so Lillian just asked if BioBoost is safe and effective in pneumonia for an elderly patient. And I just gave the short answer, yes. Because it is homeopathic, it would be safe and it would be helping to support the immune system for the patient. And then Barbara asks about, can BioBoost help with lymphocytes and not just be used for acute cases? And so, yes, absolutely. BioBoost, I know we talk about it in kind of an acute situation, but BioBoost absolutely can be used to boost the baseline of the immune function. And it really does work at enhancing the leukocytes or the white blood cells. So, for outside of acute, you can use BioBoost on an ongoing basis to basically help to boost the immune function in somebody. Okay, thank you for those questions. Okay, we are going to, sorry, these slides are just jumping everywhere here. Okay, let's start talking about some other organs. So we're going to be talking about the thyroid, the prostate, and the joints. And so Lycopus, subulceratum, and polygonum, they're all classical formulas that increase circulation to the thyroid gland, to the prostate, and to the joints. Having that increased blood flow to those tissues will help improve function, and it will also help to move toxic load away from those organs and tissues. So the first one we're going to talk about is Lycopus. And Lycopus is a thyroid support formula that helps to regulate thyroid function. The beauty in this formula is that it can be used both for a low acting and an overactive thyroid. So there's dosing that goes with more of a hyperthyroid picture and a hypothyroid picture. And so basically, like a puss, think about it for the thyroid and thyroid dysfunction in general. And then the types of symptoms that could be related. So the sleeplessness, the perspiration, the tachycardia, the lump feeling in the throat, exhaustion, fatigue, sluggishness. Um, and how it works, its mode of action, it regulates thyroid function. It increases circulation and blood flow to the thyroid gland. So this is that drainage and detox action that it has. And this is the thing that I want to really emphasize is we don't talk about um, increasing circulation and blood flow to the thyroid gland as a typical thing. We often are talking about nutraceuticals and nutrients or glandular that's going to be supporting thyroid gland, but not necessarily how to get more blood flow to the thyroid. The thyroid, it's an organ that is very sensitive to toxic load. If you just even think about radiation, for example, and how sensitive the thyroid could be to radiation. And so inherently, when we can get more blood flow to the organ, we're going to allow that organ to function better. And of course, that's the whole principle in drainage and detoxification. And so this is why Lycopus then can be used broad spectrum for thyroid dysfunction. It also regulates the sympathetic trunk by increasing vagal tone, and there are micronutrients in this formula that to help modify and support thyroid activity. So Your general dosing is 5 drops in water 2 to 3 times a day, and then drop to one drop a day. So that's your typical dosing. If you're just kind of generally working at helping to support the thyroid gland. If it's more of a hyperthyroid picture, you tend to go low dosing, so 5 to 8 drops 3 times a day. If it's a hypothyroid, so a low functioning thyroid picture, you take more, so you take 15 to 25 drops 3 times a day. And if you want to customize the dose, what you would do, and this is more in a hypothyroid picture, is you would start maybe at 15 drops or 20 drops, and you would keep going up every day by a couple of drops until the patient starts to notice symptoms. And so a lot of the time they can start to notice that their heart is starting to feel like it's racing a little bit. So once you've hit that dose, then you drop it down by a few drops, and then that's that customized individual dose for that patient using Lycopus. Okay, so now Lesia is going to jump in to talk about, oh no, sorry, I'm going to do this. So now we're going to talk about joint and prostate support. So polygonum, it is the formula that is a joint drainage formula. So it's bringing more circulation to the joints by opening up the capillaries to get to the joints and the surrounding tissue. Uh, that's part of its drainage component. The other thing that it does, it helps to reduce inflammation, and then it helps to excrete uric acid in cases of gout or high uric acid levels. So polygonum is a joint formula and an arthritis formula, but then in addition, it's really helpful in gout as well. Leslie is going to present a gout protocol in a few slides. So polygonum for those patients that have inflammation of the joints, that have arthritis or rheumatism or even osteoporosis, um, for patients with gout, for patients that have a lot of pain and inflammation associated with arthritis, this will help to create some symptomatic relief by reducing the inflammation. It can be used in nerve pain as well, in association again with the inflammation. And then the dosing, it's 15 to 25 drops 3 to 5 times a day. In a more acute situation where there's a lot of inflammation or you're working on gout, then it would be 10 to 15 drops every couple of hours until symptoms improve. And then from the joints, we're going to flip over to the prostate. So Sabal it is a formula that brings more circulation to the prostate. It also is known as a homeopathic catheter. So it opens things up because it helps to reduce inflammation in prostate conditions like prostatitis, enlarged prostate, by helping to reduce inflammation. It is opening it up so that urine can start to flow. So, for those prostate patients that have a lot of inflammation or they have difficulty urination, um, or a difficult time urinating, then Sabal is going to be very helpful because it's going to allow kind of things to start flowing again. It can also be associated with bladder irritation, with decreased libido and impotence, and with ovary pain. Oh, and the joint stuff should not be there. Accidentally, it's there. So how it's working, its mode of action is enhancing libido, increasing circulation to the prostate gland, and a big part of where it acts is called that membrane prostatic portion of the urethra. So where the prostate is kind of around the urethra, by working on that and reducing inflammation, it then takes the pressure off and allows the urine to be able to flow through the urethra. And then the dosing is very similar, 25 to 30 drops 3 times a day for 3 months, to generally for a prostatitis, enlarged prostate patient. And then if there's an acute situation where there's really difficult urination and you're trying to get things open, you could go at that 10 drops in water every 30 minutes until symptoms improve. Okay, now I want to just land on this chart. Again, this is back to this modern understanding of homotoxicology. And we talked about the 6 phases of homotoxicology in part one and part two with the webinars. And I wanted to just bring this back in when we're talking about gout, and shortly we're going to be talking about type 2 diabetes and how that all plays into this homotoxicology. So, in the metabolic syndrome kind of category for homotoxicology, phase one, the electrolyte shift. Phase two, lipid metabolism, there's disturbances there. So there's inflammation happening. The body is not being able to clear toxins out through the primary emunctories. And so inflammation is kind of taking place. And then phase three is the deposition phase. So that's when toxins are getting stored in the connective tissues. And this is where gout can start to play a role. This is where those uric acid crystals are now starting to form in the body, and then also how it's getting kind of stored in the connective tissue. As we continue past that biological divide into the impregnation stage, this is when the toxins are moving into the cells and you start to get more symptoms. So metabolic syndrome is starting to show up, and all the different types of conditions and symptoms that show up with metabolic syndrome. And then when we move to the degeneration phase, this is where toxins are now damaging the cellular defenses. So in this case, the pancreas, also cells were like insulin receptors. And that energy function and energy production are starting to degenerate. And this is where diabetes is housed. And then six, so the dedifferentiation phase is slow metabolic reactions. So we're going to give 2 examples with 2 protocols just to show where, from a drainage and detox perspective, where we're coming in and being able to use that health evolution or reverse and move toxins out of the body so that we can start to move from the higher phases into the lower phases and getting the body back into better regulation and clearing things on its own. Okay, so we've got a gout protocol, which Lesia is going to share.
Hello again. So, in terms of the gout, according to statistic of 2020, more than 56 million of people are affected over the globe. In United States, it's 12 millions. In Canada, it's 1 million, and this conditions it's not getting less occurrences, but more. So gout is very nasty metabolic disease when we have the acute episode that are so painful. Usually, men are affected 3 to 4 times more than women. And when men are asked to rate the pain in a scale from 1 to 10, usually they will give 9 to 10. Maybe they will compare with the labor pains, but they don't know how it is. Anyway, so it's very painful. It's very annoying, and it's also chronic conditions that it's not easy to address. I just want to mention in terms of it's a uric acid. We produce uric acid. It's a part of our metabolism, and we get a lot of uric acid as a byproduct of food that we eat. And so completely blocking it's not really a great idea, but allopathic approach is to use 2 products. It's the allopurinol that will reduce the uric acid, and in acute conditions, colchicine, it's used to reduce the swelling and pain, and also non-steroid anti-inflammatory like ibuprofen, indomethacin, and so on. And yes, they could be effective to address the symptoms, to address the pain, but why we are talking about the Regeno therapy? Because we are trying to support our body in healing and also help to prevent the complications. So, as we know that uric acid usually affecting the big toe, the joint of the big toe. With time, it's get arthritis and inflammations and enlarged. And when flare-ups happening very often, so obviously it's affecting the function of the joint, and it can move to other joints as well. So polygonum will be a great remedy to use because beside working as an anti-inflammatory, it also helps to eliminate uric acid crystals from the area, because there are actually the irritants or the mechanical tiny crystals that are cutting into the joint tissue, creating inflammation, creating the pain. So polygonum can be used up to 12 times during the gout attack, and until symptoms improved. And then they can be used preventatively. I just want to also mention, because I have seen how patients are reacting. The pain is so severe and the area is so sensitive, like area of the big toe, so sensitive. So even, touch of the sheet will create the pain, and the patient will scream. So we do have a sympathy to those patients. And sometimes if they need to take painkillers, that's fine, but it's not long-term solution. We're trying to support body to heal gently, and when the like acute symptoms subside, we can still support patients with the Regeno therapy. Another part of the gout is uric acid is also can affect the kidney. And as we taking allopurinol to reduce uric acid from allopathic perspective, or colchicine, they're not protecting kidney. So kidney still can be damaged. And as the gout is a chronic condition and it's not a cold that, will go on its own even if not treated, we do need to think long term. So by supporting kidney, and Heather had discussed Solidago many times in a previous webinars. Solidago is amazing for supporting kidney as an organ, improving circulation, improving function, protecting, and also has a kind of diuretic effect, so it will be helping to flush out excess of uric acid. So when you might have patients who will come with the medications, many of them will have a goal to get off those medications for the side effects, and second, because they're not really resolving the issue, and they're not preventing and protecting the organs. And once again, Regeno therapy, it's a one great tool in a toolbox, and we should not rely solely on the drainage therapy, because usually if it's a chronic conditions, it is a multifaceted condition, many reasons, and affecting our body on different levels. For that reason, acid-base balance, addressing the acidity of the connective tissue and tissue acidosis, and reversing those deposition of the crystals in the connective tissue. It's the purpose of adding on acid-based products like Pleoalcala and or basic tabs. The difference, yes, there are difference in formulations, but also from practical perspective, basic tabs, it's in a tablet form for those who don't like powders and they're on a go. Pleoalcala, very effective, but you do need to use powder, and you do need to kind of like the taste, because it is with the sodium bicarbonate, so it's not the most pleasant one, but it's not the awful one either. So in terms of the lifestyle, yes, we do have to advise our patients that to reduce food that are high in purines. So it's not so easy, because beside red meat and the alcohol and caffeine, like for example, I learned that cauliflower are high in purines. Or if we want to reduce meat and then go into the beans also have some purines. And uric acid is substance that we are producing our own. So once again, it's not easy to shut down it completely. So we do need for other important metabolic processes in our body as well. But managing the acidity toxicity of the body, it's super important. Protecting kidney, super important. So hopefully with this more physiological approach, we can reduce the frequency of the gout attack. And as we are reducing frequency, we can be more freely reduce also use of allopathic medicine, which is, the less than better.
Perfect. Okay, so I didn't. Oh yeah, there's a question. I know we said we're going to leave them to the end, but
Okay, yeah. So when it
uh,
comes, I'll answer then.
yeah. Perfect. Sounds good. Um, just topically, because it came up with two practitioners, Christine and Tanya, both are asking about using lycopus with thyroid medication. So lycopus is a low potency homeopathic. And because of that, or the beauty of that, is that typically there's no contraindications. And so lycopus, again, because it brings circulation to the thyroid, and it helps to kind of drain and clean up the thyroid. It can be used in conjunction. It's not going to interfere with what the prescription medication is. It's just the recommendation to take it away from like 2 to 4 hours or another time in the day away from the prescription medication. Um, okay, so okay, we will move on. Um, okay, so now we're going to talk about the pancreas and rubus. So it is a traditional pancreas formula that helps to stimulate pancreatic secretions, which include insulin and enzymes, and it helps to support blood sugar regulation. The one thing to really note about this, and again, something that's not always talked about, is that the pancreas is very susceptible to toxic damage from insecticides and pesticides and herbicides, which are on our food. And so, and I guess in our water as well. So this is something that needs to be thought about when we're thinking about the pancreas. Is there damage that's being caused from exposure of toxic levels from food and water? And then along comes Rubus to be able to help us with that. So Rubus is supporting the pancreatic health, and it's used for blood sugar regulation and metabolic syndrome and type 2 diabetes. So what you would think about Rubus is if somebody has type 2 diabetes, if they have elevated blood sugar levels, if they're hyperglycemic, um, it may be hard to know if a patient has pancreatic damage due to insecticide related toxicity, but if there's issues with blood sugar and there's issues with maybe enzyme production, then you can definitely consider this as a thing. Um, Also, when we were talking about that homotoxicology chart in the metabolic picture, this is part of the whole metabolic picture. So anybody with metabolic syndrome and or potentially on their way like pre-diabetes, this would be something that you could add into a protocol and potentially if they haven't moved that far along in that homotoxicology chart, it may be easier to help to reverse them away from kind of developing type 2 diabetes. So it increases circulation to the pancreas. It supports the endocrine and exocrine function of the pancreas, so stimulating the islet system of the pancreas for insulin and glucagon, and then increasing the pancreatic secretions with enzymes and hormones. So its big thing is about stimulating the pancreas, bringing more blood flow to the pancreas, helping to regulate sugar metabolism, and kind of as a whole general picture of what it's doing. And so dosing, it's 20 drops in water twice a day. So once in the morning and once at the end of the day. I do have a blood sugar protocol here. So let's talk a little bit more about Rubus in this case. So Rubus I really like to think about it as the formula that is designed to try to heal the pancreas. It increases circulation, reduces toxic load. And so it's really designed, again, kind of like Lycopus for the thyroid, Rubus is for the pancreas. And by increasing the circulation to the pancreas and giving it an opportunity to heal, in turn, it can then do better with insulin secretion and enzymes and hormones. And so then that's going to help essentially with the blood sugar regulation as well. So Rubus is stepping in as your pancreatic drainage formula. In addition to that, especially if somebody has elevated blood sugar and they need support with that, or they're pre-diabetic, or they're type 2 diabetic, and let's say they're on a prescription medication. So this is not the group that we're talking about, not an insulin dependent group, but these are people that are using other means, whether it's natural or prescription, to support their blood sugar control. Um, we can't expect Rubus by itself to do the entire job. And so for people that need support in blood sugar balance or blood sugar control, glucose balancer and Rubus become a really beautiful combination. You have the glucose balancer that's supporting the pancreas, it's enhancing insulin function, it's improving the sensitivity to insulin in the body and in the muscles and the cells. It's helping to lower the blood sugar. And there's also minerals, vanadium, zinc, and chromium in there that help to work on glucose control. So by lowering blood sugar, controlling glucose, and then supporting the pancreas with glucose balancer, and then using Rubus to help support pancreatic health and heal the pancreas, then you have this beautiful combination that is really going to help those people in that metabolic syndrome space or the pre-diabetic space, or really wanting to work from a changed lifestyle and changed diet so that they don't end up kind of in a type 2 space. This is a really nice combination to do it. The other thing, just to really think about, is there's other organs that need to be protected because there's many organs that can be damaged by excessive sugar in the blood. And that includes the eyes and the kidneys and the capillaries and the peripheral circulation, especially in the extremities. So just as a few nudges in here, self-tonic, it works at increasing circulation, microcirculation in the body, and it can be very protective of these organs. For eye and retina protection, the Pleomuc eye drops. And then finally, nerve protection, the biotrienols, which are like a vitamin E in the tocotrienol form, to support the nerves, and then vitamin B12 in the methylated form. So those are just a few additional things to be thinking about in this space. And then finally, for those, so one of the things as being natural healthcare professionals, we are in the business of also talking about healthy lifestyle. And so in that metabolic syndrome, pre-diabetic kind of space, food is a big part. So including protein and fat with meals, eating less simple carbohydrates and sugars and processed foods, and eating more complex carbohydrates so they slower release. Increasing exercise and movement is important. And then the big thing when we're talking from biological medicine and drainage and detoxification is that we have to decrease inflammation throughout the body and we have to increase circulation throughout the body. Those are some key things in kind of working in the metabolic syndrome space. And then drainage and detoxification is a really big part of how we can do that. So supporting the liver and making sure the bowels are moving, are different aspects kind of this picture. There's one more thing that I'd like to share briefly. And so so my mother, instead of just calling her a patient, it was my mother, over 10 years ago. She hadn't been great at taking care of her health. And so she ended up type 2 diabetic and very quickly was on insulin and had her toes, which were not healing. And so she had some toes amputated. And she, at that point, they were wanting to amputate her foot or even up to below her knee. It was for her a very, very scary time. And she was determined not to lose her foot, which meant that she had to completely change everything about what she was doing in her life to heal. And uh, I'm still to this day incredibly proud of what she did. So she changed her diet. She did a lot of detoxing. She took things to heal her pancreas, and rubus was one of the big things that was in there. She also went through hyperbaric oxygen therapy. Um, and in all of the things that she was doing, uh, she was able to save that foot and to heal from a really terrible ulcer and retain her large toe. So, in the end, she basically also got off of insulin, and she is actually on no medication aside from a blood pressure pill. Um, but the point is that she was on insulin, and through this process, she was able to reduce it and then come off of it and then control everything through her diet. And at this point, all of her blood markers are showing that she's not diabetic, and she does take her blood sugar a few times a week just to make sure she's in a normal range, and she's always within a normal range. So I just wanted to share this that with the right patient and with the right protocol, and in the right place for somebody to actually have the potential to heal, there is the potential. And sometimes we have to go down a few routes to support that. But just to keep that in mind that, rubus, when well placed with somebody who's determined, you can, and as my mother says, it healed my pancreas. So thank you for listening to that case. Okay. So let's move on here. Okay, so we're coming close to finishing up our presentation. We have a few more remedies that we want to share. So Aeschylus and Lapa, these are to improve circulation, both arterial and venous circulation. Venous circulation very specifically, and reducing venous congestion. Um, this picture is a really good example back to the homotoxicology chart, where you have normal veins moving all the way into varicose, swelling, skin changes, and ulcers. And so this is that picture of moving from phase one to phase three, four, five, six. And so what we want to do is we want to help people not have to get down to that stage. And so we are going to pass it over to Lesia to share about Aeschylus and Lapa.
Yes, thank you so much. Once again, two great remedies from Regeno Therapy. It's Aeschylus and Lapa. Aeschylus, it's the known for the circulatory and venous support. And once again, you can see it's a demonstration how Aeschylus, we know that yes, it's for the hemorrhoids, it's for the varicose veins. And why? Because as a herb, as a plant, Aeschylus, it's a horse chestnut. It has affinity to that organ, so we know for sure what it will be working on, and it will be working on a poor circulation, arterial, peripheral, venous. So it helps also with the cold hands and feet, even though we have some other remedies for that as well. And today I will also want to focus on varicose veins and hemorrhoids. So the obviously it comes with the other symptoms like edema and congestion and tingling and numbness in the arms and legs. But again, it's all due to impaired circulation, which means it's affecting the function of the tissue and organs. So if we have tingling and numbness, it could be a neuropathy due to impaired circulations, like in the diabetic patients, or peripheral like ulcers and trophic issue, once again due to ineffective delivery of the nutrients and the oxygens. So using Aeschylus, we can use for so many areas as an add-on. So it will help with the varicosities. It will help in a diabetic when they start losing the feeling in their feet, and if they feel the feet are very cold. So we can always check the circulation and employ iascolus. But I also want to mention, in terms of the hemorrhoids, that's kind of my personal perspective. I always are always looking for the root cause. So with the hemorrhoids, it's two things. One, it could be integrity of the wall, the venous wall. So yes, you have to take a lot of antioxidants and take care of the elasticity with the collagen, hyaluronic acid, and vitamin C. But another one, it's also could be just ineffectiveness of the venous circulations. And uh, it comes back to liver. Liver is very important organ for not only detoxifications, but also constipation. Remember when we were saying that constipation, it's a result of the sluggish gallbladder. It's a result of the dyskinesia of the bile, and if it's not sufficient amount of bile is produced and released, then it can lead to the constipations, and constipations can lead to hemorrhoids. And when we are just addressing the hemorrhoids as a symptoms, then it's a halfway. But if you want to prevent them, then we should use liver detox along with the iasculus for them. So reducing the portal vein congestion. Also, vena porta, it's a big vein that lies beneath the liver. So, and if liver is congested, it's actually mechanically will push on a vein and will not will create portal hypertension. And portal hypertension obviously can lead to some varicosities in a rectum and yeah, mainly in the rectum and the pelvis. So as you can see, we have a product for varicosities, but we can affect so many different conditions because at the end, if the circulation is impaired, iasculus can help. If the wall integrity is affected, iasculus can help. If it's a diabetic side effects, like the consequences, iasculus can help. So please use this, could be used alone, but also add on to your other protocols. So acutely for the hemorrhoids, you can take 20 drops in water 5 times, up to 5 times a day, and as improvement shows, reduce the frequency and the amount. Also for the inflamed varicosity on the legs, we do have a you can use iasculus, but also don't forget that we have a nattokinase, and nattokinase is amazing for the advanced state of varicosities, like with the thrombosis. So if you need more complex protocols, we'll be happy to discuss case by case and help to tailor the protocol for your patient's need using the different products that Biomed has to offer. Lapa, it's our blood purifier, and Lapa can be used standalone, but it's an amazing remedy just to add on. So it has some function of the lymphatic and blood cleansing. So it's great to use when the healing reaction happening, like for example, when you do start some of the detoxification and you just need stuff moving out. I would use LAPA as a part of the weight loss protocol when we are start with some liver remedies, obviously, when we start releasing the toxins. So we by releasing the toxins, we also need to properly eliminate them. And those eliminations are happening through the kidney, through the intestinal, and through the skin, not only just putting kind of burden on one organ, but it's a little bit more complex. Through the lymph, but also from the broad spectrum detoxification. So LAPA can be, like I said, can be used along with the iasculus, along with the liver drainage, in a weight loss protocol, in a gout protocol, depend what is needed. And because we have variety of the products, we can really combine them in a different way and tailor in individual protocols.
Thank you, Lesia. Okay, so we're going to now talk about the nervous system and adrenals. And so these are two classic formulas that help to calm the nervous system and rebuild energy with fatigue and exhaustion. So the first one is Avena Sativa. And Avena Sativa, it's a herbal formula that is working to calm the nervous system. It works on the central nervous system and on the sympathetic and the parasympathetic nervous systems. And then it also, of course, helps to reduce stress, improves the ability to handle stress. It reduces what's called neuronal excitability. So it's basically nerves that are overstimulated or kind of, excitable. It helps to kind of calm them down and the nerve conduction, and it slows down nerve signal transmissions. So this is how it's working to calm the central nervous system down. So somebody has an overstimulated or an overactive nervous system, this is going to be a very calming formula for them. The other thing is it regulates circulation, by vascular tension and reducing sympathetic flight or flight nervous system response. So vascular tension creates a vasoconstriction. So it constricts, and then that contributes to restlessness, anxiety, headaches, etc. So it's helping to release this and not have so much tightness in the whole vascular system. So, Avena sativa, that's the modes of action that it works. It works on an overactive nervous system, nervous conditions, nervousness, restlessness, people who are very oversensitive to stimulation, so hyperactive, oversensitive, overexcitable, that get over threshold. Um, Stress, anxiety, heart palpitations, which is all part of that picture. And then people who have a hard time falling asleep. So that insomnia, that's due to a very busy mind, and a non-calm body. So it helps to calm the body and it helps to calm a busy mind to help prep for sleep. Now, with Avena sativa, um, the thing that's really beautiful about it is it's non-drowsy. It's not a sedative formula, and it's a calming formula. So it calms without having a sedative effect, which means you can take it during the day. This is the key in thinking about this. It's not taking it before you go to bed at night, but instead, when you're using it during the day, it's helping to calm down the sympathetic nervous system. So when you're moving into getting ready for bed and in the evening and needing to switch over to parasympathetic mode at night, the nervous system and the body's able to do that switch much more easily, which then means that if sleep is an issue because of a busy mind and an uncalm body, this is already helping to do some regulation there. So this is how Avena Sativa works. It also is very effective within 20 minutes. As we mentioned at the beginning, the Regeno Therapy formulas typically work within 20 minutes. So this is a very calming formula that somebody can take throughout the day and also before bed. So general dosing, it's 30 drops in water 3 to 5 times a day or as needed. And then as a sleep aid, 40 to 60 drops, which is half a teaspoon or so in water just before bed. With the clinical pearl as take it during the day so that you can switch and have an easier time sleeping. Okay, and then I want to share about adrenal support. So we have Adrenum, and this formula, it's the same. It's a non-stimulating formula. So it's used to rebuild energy for those that are in fatigue and exhaustion and adrenal burnout. It basically is revitalizing and recharging energy levels and restoring adrenal function without stimulating. And then, in addition, there's micronutrients that help to increase the function of the sympathetic nervous system and kind of vascular activity in the body. Those are the things that need to be understood about this. A lot of our adrenal formulas, they have adrenal glandular or they have different adaptogens or different stimulants. And in early stages of adrenal fatigue and exhaustion, those are things that could be used to get the adrenals back on track or also to stimulate to kind of get the energy up. But when somebody's moved into more deeper stages of burnout, like stage 3 and stage 4, you don't want to keep pushing the adrenals via stimulation. Instead, you need to nourish and restore and revitalize the adrenals and give them the proper rest and recuperation so that they can come back online to function the way they need to. And so the picture would be adrenal stress, adrenal fatigue, adrenal burnout, tired, fatigue, exhaustion, feeling frazzled, feeling overstimulated, that 3 p.m. crash, and the 4 to 5 a.m. night sweat. If you have patients saying to you that aren't menopausal, but are saying to you, "Oh, I wake up or between 4 and 5 a.m., or I wake up and I'm hot or I'm sweating," between that 4 and 5 a.m. time, that's pointing directly to the adrenals. Also, patients that are reaching for sugar or salt or stimulating stimulants like caffeine, for example, especially in that 3 p.m. crash, it's another point towards the adrenals. People who've had long periods of stress and then have nervous exhaustion. So they're mentally or physically exhausted. Their nervous system is weak. They lack motivation. They're kind of in a weak, kind of collapsed state. Then adrenum is a beautiful formula to add in. I do want to make a note on this one. So one of the it's a homeopathic formula, which is why it's quite gentle. It does have homeopathic caffeine or caffeine in there, and sometimes we'll get the questions of, "Oh, I'm sensitive to caffeine," or, "Oh, this is not supposed to be a stimulating formula. It has caffeine in it." But just remember, it's a homeopathic ingredient, which means that when you're using it as a homeopathic ingredient, it's not caffeine's not in there to be stimulating. Instead, it's for the overstimulated, overcaffeinated picture, which can be kind of that exhausted fatigue picture. So just make a mental note on that if you have patients asking about that. Okay, and then we are going to move into, I believe it is our last formula. So thanks for sticking with us. I know we've covered a lot of territory in this webinar tonight. We're going to be talking about female tonic as a traditional hormonal tonic formula that increases circulation to the female organs, and supports the liver and the adrenals for hormonal regulation. I love to say female tonic is for all stages and phases of menstrual and menopausal health. Okay, so we're going to pass it back over to Lesia.
Yes, thank you, Heather. And exactly is this is what has been used. This formula have been used in Germany for over 60 years for women of different ages, and it's exactly to restore, to support hormonal balance in women and to support physical and mental exhaustion in women of any age. And all the key is the in a word tonic. So it's not over to stimulate or to suppress, it just to regulate and balanced. So the remedy are, it's close to 20 remedies in a formula, and they are designed to support not only reproductive organs, but also circulations, including even heart. So this is truly well-rounded and multifaceted formula to help women to go through different stages. And yes, if there is a PMS symptoms like breast tenderness, mood swing, craving, acne, then this will be indicated. Also, hot flashes with the night sweat, sleepiness, low libido, vaginal dryness, and even with the metabolic disturbances when it's a hormonal related, the female tonic it's an amazing product. So the main purpose is the hormonal regulations, but through the gentle support and improving circulations to the organs, helping with the liver detox, and overall supporting the menstrual health. Talking about the liver support, yes, there are remedies, there are ingredients and herbs in the formula that support the liver, but you can always add our A hepatica because liver is the central plant for the hormonal balance. It is responsible for metabolizing, deactivating, and cleaning the excess hormones, especially estrogen. So when we have a two-phase detoxification, then the excess of the hormones are eliminated, and this prevents the accumulation in the bloodstream of the sex hormones that leads to PMS, to acne, even to endometriosis. And it's specifically, in the cases of estrogen dominance. So while we do have other supplements like dim detox and liver detox that can be combined together with the female tonic, female tonic is important because of the overall support of the female body and female hormonal balance. So personal story as always. I was gifted the female tonic. It happened, and it was time when my menstrual health period was not as regular after the third child. So actually, nothing was wrong with me, according to my family physician, but female tonic actually helped me to reestablish really healthy cycle until the menopause time. And this is truly, I can praise the tonic to be so gentle but being so effective. So please try. It's not replacing any hormonal like the bioidentical hormones or something. But if it's a young girls, or if patients are taking so many other medications, please use this as a supportive therapy. The dosage is, now we used to have this in a syrup form, were very tasty and yummy. Now it's the more concentrated. So 30 drops twice or three times a day will be effective and enough. Yes. So when we are addressing the hormonal balance, as I mentioned, liver and gallbladder support for the hormone detoxification or estrogen detox is important. You can use A hepatica, or because the excess of hormones are eliminated with the bile, cardus probably will be even more effective, as we have some herbs for liver support in female tonic. So cardus will be grade one, especially for those female patients who have gallbladder issue as a sign of the estrogen dominance. As you can see, in our bodies, everything interconnected. Usually you will find estrogen dominance, and estrogen will lead to the bile thickening and gallstone formations. So you're actually helping body not only with hormone regulations, but also preventing gallbladder stones and gallbladder attacks and gallbladder removal down the road, just by helping detoxify excess of the estrogen. So cardus and female tonic is great combo. Lapa, as I had mentioned in the previous slides, it's a great overall broad spectrum detox for the metabolic cleansers. So it's great when you are supporting women with the weight loss during the menopause, or just to improve like water retention or the stagnation in the body. And you can use kind of occasionally, you can use on a weekend, so it's not as intense and not as overwhelming. So one teaspoon mixed with the water twice a week will be a great add-on to eliminate endocrine and metabolic waste.
Great. Thank you, Lesia.
A pleasure.
Okay, so we have just a couple more slides here, just to finish off the presentation. So I just wanted to point out that we've got a number of resources. So there is a drainage and detox therapy guide. There's a hormonal balance handout that Lesia just talked through in our webinar number one or part one, the drainage and detoxification. There's a handout for that. And then there's also a questionnaire you can have patients do to see if they're a good fit for needing to do the detox kit. And then we have some smaller handouts that are for absinthium and hydrastis nasal spray. So if you want any of these types of resources, you can always request to have them added to your order, and they're available on the website to download as well. Okie dokie. And then I just wanted to do a quick summary here. Back to why use Regeno Therapy in daily practice. Drainage and detox in the world that we live in, it's essential, which means it can be essential for every single patient in every single practice. Spring and fall detox is a great place to get started with the detox kit, and the spring detox season is right upon us. So is allergy season. So sinus and respiratory conditions and seasonal allergy relief. Lesia talked about the hormonal balance and a really beautiful way to be able to support kind of menstrual, menopausal health and to get those hormones better balanced in the body, and a very well thought out formula that's not just about hormones, but also focusing on the liver and bile as well. There's beautiful cold and flu support, and then very targeted organ support. And then most of these remedies, when they're working symptomatically, have relief or effects within 20 minutes. So allergies and sinusitis are two really great places, and the nervous system, to calm the nervous system. So, lastly, this is the family of remedies, the Regeno Therapy family of remedies. And so you can see it's a beautiful line. One of the things that I've talked about a lot is it's not a very complicated line in the sense that the formulas they are designed to be specific with that targeted circulation to the organ, and then creating that biochemical effect and helping to eliminate toxins. Um, Basically, with these remedies and these formulas, there's 60 or 6 decades worth of experience using them. They're easy to use protocols. Leslie and I reviewed quite a few great protocols during this webinar. And of course, we're always here and available to help you make customized and individual protocols for your patients. Just get in touch with us and we're happy to be able to walk you through that. Um, we're addressing root cause, not just the symptoms. They're safe. Majority of them are safe for all ages. They're non-toxic, they're non-allergenic, and there's no or very minimal side effects with them. And the other thing is for those of you that have been on part one, part two, and part three of the webinar series, or you've only been able to join some of them and are listening to the recordings, this is your initial training on how to use these formulas. So you don't have to have intense practitioner training to be able to start using them. And then you can combine the remedies depending on what you need to do. The detox kit's a really good example of that, or the hormone balance protocol. And so I encourage you, reach out, let us know questions, let us know how we can support you. If you want to try one thing, if you want to try a few things, we're really happy to help you learn how to integrate those into your existing protocols or as these remedies on their own. And so then thank you for joining part three of our Regeno Therapy Drainage and Detox webinar series. Okay, so Michelle asked the question about female tonic. Would female tonic benefit clients with PCOS? And that's polycystic ovarian syndrome. Lesia.
Yes, just a second. Yeah. Yes, PCOS, yes, it will help because it's a hormonal balancing. We know that myoinositol is another great supplement that can be incorporated in the protocol. So it's not just female tonic. Female tonic, it's a great kind of base remedy, but we have to do some other stuff as well. So if this is estrogen dominance, or if it's like insulin resistance, because again, PCOS, it's the kind of a complex issue. So female tonic will on its own will not resolve it, but it's a great remedy to use it for it.
Great. Thank you, Lesia.
No problem.
We have another question here regarding female tonic.
Uh-huh.
Is it good to take during menopause and after menopause?
Yes, because it does affect the libido, vaginal dryness, so mood and the nervous system. So it's amazing, very effective even for hot flashes and sleep disturbances during the menopause, and great in postmenopause. But also, I just also want to mention to you that in a menopause, when the ovaries are done with the reproductive function, our adrenal gland in a female body is taking over. So if you want to maintain your kind of hormonal balance, this is what adrenals are doing. They're producing estrogen and testosterone and our, sex hormones. So adrenal support will be crucial along with the female tonic to feel your optimal.
Great. Thank you, Lesia. Liliana asks a question again about female tonic. For uterine fibroids, would you recommend A hepatica, female tonic, and LAPA?
Okay, with the uterine fibroids, yes, it's the case of the estrogen dominance because estrogen makes things to grow. So we do need to detoxify the excess of the estrogen. So we can start with A hepatica. If patient never did a liver detox, it will be super beneficial, and LAPA will be great as well. Also, female tonic. Female tonic will be great, but it's not enough because we already have a excess tissue and we need to somehow to eliminate. Luckily, we do have systemic enzymes. And systemic enzymes, it's the pancreatic enzymes in our body that are digesting any non-functional proteins or non-functional growth or benign growth like fibroma, fibroids, fibrosis in the breast, fibrocystic breast condition. So we have a serapeptase and a clear even more effective to be used to digest in a protocol to digest those growth like fibroids. But how do we know that systemic enzymes will go to the right place? For that, we are using female tonic as a it has affinity to the reproductive organs, to the uterus. So yes, we can combine, we can start with the liver detox. We can even get at DIM detox, which is great for the estrogen eliminations and estrogen detox, and then start to digest the fibroids by combining clearazyme with the female tonic. And we can send you a protocol, Liana, with no problem. And if you want to discuss specific patients' issue, Heather or I will be able to help you.
Great. Thank you so much, Lesia.
And
Uh,
I can answer about the this one as well,
yes.
Heather.
Okay. Yeah, please do.
Yes. So ankle brachial index is just the diagnostic tool measuring the blood pressure between the arm and the leg, just to kind of see if their peripheral circulation is affected. So to say if it's going to help, we don't know, but yes, you can use this test to see how things are improving with the peripheral circulation. And obviously, you can start using Aesculus, you can start using LAPA to, and but it's not alone. I would strongly suggest to consider serapeptase and nattokinase to improve the peripheral circulations. We do even have a self-tonic, which is another superb remedy for the microcirculation. And as you can see, we have so many tools that we can create tailored protocol for your individual patient. So feel free to reach out and we can discuss the case in details.
Yes. Thank you, Lesia.
No problem.
So we have a question. Can the remedy still be safe if a patient has high liver enzymes and concerned about the alcohol content? So this is a great question. One of the things you can do if you're concerned about that or the patient's concerned about it is make your dose up the night before and let it sit out for 12 hours. And that will help evaporate the alcohol off. However, with these formulas, there's very small amount of alcohol that's actually going to be taken in the dose because you're diluting it in water. And so ultimately, there's not actually a lot of alcohol per dose. One thing to just make note of is when you eat an apple, your body makes more alcohol within from a digestive process than you would be taking per the doses of the remedies. So just to help put that in context, however, some people prefer to just have the dose sit out overnight and the alcohol can evaporate, and then you don't need to be so concerned about it. And then lastly, without knowing much about this patient, maybe some liver support will help so that it can get their liver back online and function, and the liver enzyme values will go more towards normal. Leslie, do you have
Exactly.
anything to add to that?
Yeah, because liver enzymes, it's exactly the sign that patients need a liver support. Because liver is a noble organ. It has the ability to self regenerate and self heal with the proper support. So we are not like the liver enzymes could be sign of the fatty liver disease or due to sclerotic changes. But again, there are some changes are reversible and will be happy to help you to create the protocols. Like for example, once again, systemic enzymes like serapeptase or clearazyme to break down the sclerotic tissue in the liver that actually non-functioning properly and resulting in the elevated liver enzymes. If we're addressing the root cause, so you will see the results. But again, it's a little bit more advanced. At the end, elevated liver enzymes are just simply indications for using liver detox.
Great. Thank you, Lesia.
You're welcome.
There was a few things that we just answered kind of via chat, and so I just wanted to read them out loud. For Avena sativa, is it safe for kids? The answer is yes, it's great for kids. You just want to do a reduced dosing. So from 2 to 6, it's a quarter of a dose, and 6 to 12 is half the dose of the adult dose. Um, Okay. And if somebody's doing a spring detox, can they benefit from a secondary protocol? Can they be done together? So this is a pretty wide open question, and it really depends on what's going on. Sometimes a spring detox is enough to do a beautiful clearing of the picture. Sometimes they have other things happening, and so this would be a more of an individual, let's get onto a call with either you or Alessia and one of us, and we can hear the patient case to see what would be appropriate. Sometimes you can do things together, but in this case, we'd need a few more details to know what we're talking about. Um, okay, we had a couple of questions about glucose balancer and Rubus, if they could be done together. Yes, you can absolutely do them together. The main thing is Rubus is meant to be, no, sorry, glucose balancer, you're supposed to take it with a meal. Rubus, because it's homeopathic, you take it away from a meal. So you wouldn't necessarily take the Rubus and the glucose balancer at the exact same time. They would be at different times of the day. And then another question about Rubus and glucose balancer. Would you start it in phase 2 or phase 3 if you're doing a detox system? And I thought that was a really good question. Ideally, if you're working in a big picture with a client, making sure that those primary emunctories, so the kidneys, the liver, so bile, so also the gallbladder and the bowels, you want to make sure all of that's flowing and moving first, because it's essential for those detox systems to be in place and then starting to work on something like the pancreas. So I think that probably the best would be to start Rubus maybe after you've done some round of working on the liver and the bowels to make sure that they're moving and maybe the kidneys, and then Rubus later. Glucose balancer could be added at any point, including at the beginning, because it's supporting blood sugar balance and blood sugar control. Okay, well, we've had so many wonderful thank yous. Thank you very much, everybody. We are at our end. We're definitely over
Yes.
where our time. So for those of you that stuck it out to the end, thank you so much. There's lots to share. So
Yes.
enjoy the rest of your evening.
Yes. Thank you so much for your time. Thank
Yeah.
you.
And we will see you next time.
Next time.
Okay, take care. Bye, everybody.